combat, but I really want us to pay attention to what is going on around us, because obviously this virus is definitely serious, and the symptoms are serious, and we can definitely be in a lot of danger, especially if we don't seek help and if we don't identify it, because some of us have all kind of symptoms and we're just walking around spreading it and don't even realize. So I was just saying, Samantha, I don't know how much of it you caught, but I was just saying that it seems to me like shortness of breath and the incessant coughing are two of the symptoms that we really have to pay attention to. Did I get that right?
Yes, but you see, the thing is, because it's such a new virus, we have to keep our ears on the ground and keep listening out for the updates and trying to find out, because what we're seeing is initially, yes, fever, cough, shortness of breath. Those are symptoms, but then we also have persons who are presenting with diarrhea. So it's a viral illness, and it's, I don't know how to explain. It's just feelings you get. You get joint pain, muscle pain. You can get sore throat, runny nose, sneezing, headache,
inflammation,
joint. So and diarrhea happens as well. So it's not to say, oh, you're having some muscle pain, you're having some joint pain. Say, no, man, it's not COVID. I'm not going to anything. That's what I'm saying, because it's so new. The moment that you feel that you're having an issue, and we love say, oh, I just have some sinus. And a lot of times, the persons who are having the running at the back of the nose and a little stuffy nose and the sore throat, they can come back as having COVID. So that's why it's important to say, even if people think you're being hypervigilant, if you're having any of those kind of what we call viral symptoms, it's best you just reach out for advice, because the most that's going to happen is that they say, okay, just come in for testing, and then asking you to stay at home for 14 days and self-quarantine. And I always think it's better to be safe than sorry. And even before somebody tells you that, if you're having those symptoms, before you even get the results or get tested, you can choose to self-quarantine as well, and in an effort to try and protect the persons around you and the persons who are in your home. So that would mean we're staying mostly in one area of your house, and if you have to go out in general areas like, say, a bathroom or a kitchen, that you would put on a mask and you would social distance, and you'll really try to limit contact with persons in your household as well.
Oh wow, that's gonna be hard, especially with people with children.
Yes, there actually some. The last time I checked, because this was a conversation I had. I'm also going to plug my podcast, because I have a podcast.
Plug your podcast. Plug it away.
Yes. I have a podcast episode with I can only remember her first name right now, but with a pediatrician rather, and it's called COVID and Kids. It's on my podcast, the Layman's Doctor podcast, again on my page, and we talk about COVID and its effect on both parents and its effect on children, and we talk about the various protocols, especially with breastfeeding. And there are some protocols where women who are COVID positive can still actually breastfeed based on how their symptoms present. So this is again why it's another reason why you don't just say, you just stay at home with it, because there are different protocols in place, and it's best that you get the advice on what to do from someone who is trained to give you that advice. So if you have small kids, or especially if you're breastfeeding, there might still be a way for you to, and especially if you're the primary caregiver, there might still be a way for you to care for your children and care for your baby and still keep them safe as well.
Okay, wow. I didn't even think about breastfeeding. I'm good to hear about that stuff, because I mean, that's food source for the baby. So I mean, I'm glad there's a way. So based on that, then the virus doesn't pass the breast milk. It's really just a matter of protecting the mother and child.
So the thing is, so this was maybe we did the podcast maybe in about April, or March. So I'm not sure if there's a change to the protocol, which is why I said always speak with the pediatricians, the obstetricians. At that time, the data wasn't suggestive enough for people to say stop breastfeeding if
Okay.
you're asymptomatic. I
Right.
think that was the general consensus of that.